Well, good afternoon, ladies and gentlemen, and welcome to all of you to a very special webinar that we have organized today. Our guest today is His Excellency Ambassador Paul W. Jones, who is Chandy Affair of United States to Pakistan. Ambassador Jones, he has served twice previously as US ambassador to Malaysia and to Poland. During his postings in Washington, he has served on very important positions, Deputy US Special Representative for Afghanistan and Pakistan, and Deputy Assistant Secretary of State for South Asian Affairs. Excellency has also served concurrently as the Deputy Commandant and International Affairs Advisor at the National War College, National Defense University in Washington, D.C. He has received Presidential Meritorious Service Award and the Robert C. Frozer Memorial Award for Peace Building, and several Superior Honor Awards as well. He is a fluent speaker of Russian, Spanish, and some Polish. He graduated from Cornell University and received master's degree from the University of Virginia and the Naval War College. What a dignified career and credentials, Excellency. Now, to set the scene, of course, you will be sharing your thoughts with us. But let me begin, Excellency. When we look at the numbers today, we can see that 262,000 recoveries in United States. Of course, while United States is hit badly with 1.38 million cases, the number of recoveries is also very encouraging. Of course, the mortalities are there. They are reaching around 82,000. And with all this, one need to learn from United States how to bounce back. Indeed, United States has able to bounce back after the very acute attack of this pandemic. Life is now starting normalizing in certain states, and there are certain lessons learned for Pakistan, what it should do and what it should avoid. When I look at some of the similarities between Pakistan and United States in this pandemic, I can clearly see the role of federal government and the whole federal governance system. In case of United States, we can see at one point the mayor of New York, the governor of New York, and the president of United States, the three of them, they took some time to be at one page. There were some difference of opinion in the beginning. The same we can see in Pakistan, where we have federal government and Sindh province, which perhaps are taking some time to adjust on the same page. We could also see in both the countries, in case of United States, due to health insurance, private health infrastructure was much developed than the public health infrastructure. And same in case of Pakistan, not due to insurance, but due to lack of capacity in public health sector, or lack of investment in public health sector. The private health infrastructure is much developed than the public health, but now it's the public health sector which is raising to the call of duty. So there are certain similarities between both the countries, how they are dealing with pandemic. But one important thing that is now very major question for Pakistani policymaker is how to keep a balance between lives and livelihoods, when to relax the lockdown, and what would be the threshold where we have to come back again with a very strict lockdown. And United States is again facing the same issue. Some certain states, they want to relax lockdown, other states they want to have strict lockdown. So we would definitely like to get educated from you about the strategy, US strategy of fighting against this pandemic. But there are two other issues as well we would like to hear from you. One is about the debt relief and debt rescheduling. Our Prime Minister of Pakistan, the appeal that he made for debt rescheduling and debt relief to the developing countries, how would United States be reacting to that appeal, and especially in convincing other bilateral partners? And also on the vaccine front, we know that the pharmaceutical industry in United States is quite actively working on it. So can we expect any good news by the fall on this vaccine front? And once it's done, how would developing countries get benefit of it? And finally, of course, your own subject, which is how United States is helping Pakistan in these troubled times while fighting against this pandemic at domestic front. Of course, we are also supporting Pakistan, and we would like to hear from you how you are supporting Pakistan, and any thoughts on Afghan peace process, since you held these very important portfolios, special representatives for Afghanistan and Pakistan. So whether this pandemic negatively or positively affect Afghan peace process. So I think I've spoken enough, and I tried to give you some pointers so that you can structure your thoughts. I know you already have some points that you would like to share with us, but I thought that I should also raise some of the points that I feel that the audience would like to hear from you. Over to you, Ambassador. Thank you very much.
Well, thank you so much, Dr. Solari, and thank you to everyone at SDPI for organizing this this meeting. I see quite a number of friends are on the screens. At least I see your names. Sorry, we have to do this virtually rather than in person, but really appreciate everyone who's participating today. Along the lines, Dr. Solari, that you mentioned, obviously coronavirus has hit the United States very hard and is still going on, and rising, falling in different areas. But I just wanted to say how much I appreciate and we appreciate the huge numbers of messages of sympathy and support for the American people during this time, which we also offer to the Pakistani people. We're all in this together all around the world. You asked me in particular in your invitation to discuss US-Pakistan cooperation amid COVID-19. I'm happy to delve into some of the other issues you were raising, perhaps toward the end, but there's quite a broad topic that you gave me to begin with. So let me, if I could, touch on the four parts of that you highlighted in your invitation. One, the current status of our cooperation between our countries. Two, the U.S. help on both the economic and the health fronts, and you alluded to some of that. Three, ways to strengthen our cooperation, and four, avenues for sort of longer-term cooperation in health. All excellent topics, and I'll try to touch on them briefly and then open it up to conversation. And I'm delighted to stay till 5. We have a number of people on the line, and be happy to answer questions to the best I can. But first, I wanted to say the United States very much wants Pakistan to succeed against coronavirus and to mitigate its economic effects. This comes from the top. This comes from President Trump, who has spoken with Prime Minister Khan about coronavirus, about how we can have a coordinated response. We recognize very much that we're all connected in this. A healthier Pakistan means a healthier United States, healthier world. We're also connected by the need for getting back to a growing prosperity rather than the economic hit that we're all taking. And we very much want to get back to, as major trade and investment partners, get back to the growing our commercial agenda, which we had been very much focusing on before this started, and we keep focusing on. But in short, the United States stands with Pakistan against coronavirus. And second, we would like our political relations to emerge stronger based on the cooperation that we are currently have and want to expand in this period. We've had our difficult times, particularly over sort of different years over the last decade. we started to change that dynamic with cooperation on Afghanistan, and I'd be happy to speak a little bit more to that later, which is very much in our mutual interest that there's a negotiated, peaceful resolution to the war in Afghanistan. And then we added in to the relationship, as I mentioned, really focusing on the commercial cooperation. How do we expand trade? The United States is, by far Pakistan's largest export market, and you want to grow your exports, so it's a logical thing. And there's quite a number of U.S. companies that are very interested in expanding investment here. So we were focused on that a lot, including with the visit of our Secretary of Commerce, Wilbur Ross, back earlier in the year. And now we can add on top of that, or bring to the fore a little bit, our understanding of our health partnership and how important that can be in both the short, but as you mentioned in your letter, the longer term relationship between our countries. So I want to take just a moment, and because it's not so well known, that we have worked closely together, our two countries, on health for a long time, and it's a very strong foundation. That's more important now than probably ever before. But the original cooperation goes back, spearheaded by the US CDC, Centers for Disease Control, back to the 1980s, and stepped up considerably in the early 2000s with cooperation and resources that CDC brought to work together with the Ministry of Health and later the National Institutes of Health here in Pakistan, starting with influenza, but then expanding on joint training for what's called field epidemiology and lab training on the whole range of diseases that confront our countries. And in that process, graduating over 2,400 district and provincial field infectious detection specialists and outbreak response specialists, and over 800 healthcare and lab personnel. So this has been going on for quite a while, this relationship and this training program, which we have recently stepped up and focused, obviously, on coronavirus. And the United States Agency for International Development, USAID, has also been very active in the public health arena for years, complementing CDC. We're adding now, we are just shortly we'll have one, and then shortly after that, another senior specialist from our Centers for Disease Control in Atlanta, who will be coming in to join our mission to strengthen our analysis and our coordinated response with Pakistani health authorities. And then more broadly, the United States has been long the world leader in public health assistance and continues that tradition. We've now, since the outset of coronavirus, committed over $900 million in new funding in countries across the globe fighting the pandemic. And Pakistan, among those, we designated as a priority country, partly for this foundation that we have to build on here. So this, in our view, this long-standing health partnership has enabled us to move very quickly to respond to critical needs identified by Pakistani authorities, and to expand our joint work that had been going on already and expand it quite dramatically, such as the field training I was mentioning earlier. Just a couple of examples. So within 48 hours of a request from the health ministry, the federal health ministry, back in February, USAID was able to collaborate to fund and build a website that is now being used by NDMA and donors for procurement and inventory of PPE. So this is the whole effort. You can see the website. This is the whole effort of procuring and inventorying PPE to make sure it's tracked and appropriately distributed. Just one of the quick areas we were able to respond to. And then more broadly, in several different tranches, we've devoted over almost $15 million in new funding for example, mobile labs that can be deployed, and they'll be deployed in the coming weeks to hotspot areas around the country. So you can test people and treat people in the actual hotspot area. Expanded healthcare worker training specifically designed to treat effectively those people who can stay at home and don't have to come to the hospital in order to keep the hospitals from becoming overwhelmed. We're working on upgrades to emergency operations centers in the provinces, which we've worked on before, but now we're adding new levels of technology and connectivity together with the health authorities in the provinces. And we've added support through UNHCR, the High Commissioner for Refugees, for training and healthcare supplies to Afghan refugees and also the host communities where they live here in Pakistan. And then on the economic impact, we are contributing $5 million to the ESAS Emergency Cash Grants Program to the most vulnerable in cooperation with the British USAID equivalent DFID. And then separately, I just announced recently we are contributing $2.5 million for therapeutic food for children with malnutrition and medical equipment to help treat malnutrition. In addition to those new contributions, we, like other development partners, I believe, are sort of going through very thoroughly, scrubbing all of our development partnership programs through USAID and other avenues to find ways to redirect them to help against coronavirus. So just for example, our English language teaching programs that we do, we have radio programs, for example. We also have an after-school program called Access, English Access, which is a program that normally meets in person, but is now transitioned to online, and all the students are online. But we've infused all of those programs with messages on social distancing, on hygiene, on staying at home, and also with recognizing and supporting and respecting healthcare workers in the country. In all, so there's lots of examples like that I could go through, but in general, we are working actively with Pakistani authorities to see where we can be most helpful on additional contributions to meet urgent needs, and all of these contributions are grants, coming from the American people. To the point you mentioned, Dr. Saleri, more broadly, the United States supports Pakistan in international financial fora by leading the G20 debt suspension initiative, which will provide, if it all goes well with all of the negotiations with all of Pakistan's creditors, some $1.8 billion in relief over this calendar year. And we also were strong supporters of the IMF giving Pakistan a almost $1.4 billion rapid financing instrument. So in sum, we're quickly expanding our health and poverty alleviation partnerships to contribute to Pakistan's fight against coronavirus and its economic fallout. But I wanted to just touch on a couple of other dimensions, because this effort is far greater than a government only or a government to government effort in Pakistan, in the United States, and elsewhere. So for example, US businesses that are invested in Pakistan are contributing both from the humanitarian and social responsibility side. For example, Accelerate Energy, which is one of the companies that helps bring in natural gas here, made a substantial contribution to the Karachi Relief Trust for food rations for 25,000 low-income families for a month. Pepsi, Coke, McDonald's, Hardee's, KFC are all contributing free meals to healthcare workers, law enforcement, and those impacted directly by COVID-19. And Uber is providing free rides to health workers and delivering meals. Many more such examples. And then looking at businesses who are directly, who have more direct ability to impact the current crisis. I met yesterday in a similar sort of setting with a number of representatives of a number of US medical and pharmaceutical companies that have an active presence here. And most of the major ones are here. They also are all providing humanitarian and social responsibility support in their communities and their areas. And they're looking for ways to increase their production, both for local consumption to make sure all of Pakistan's needs are met, and also to enable Pakistan to export, whether it's specialized medical products or pharmaceutical products. And I think, as we all hopefully know, Pakistan has really done quite a remarkable job in dramatically increasing the production of PPE and some important pharmaceutical products that could add to Pakistan's exports. And so we are now, once local needs are met, and that's largely being met as far as, what we understand of the level of production. So we are looking at how to help this become an excellent opportunity for Pakistan to become more integrated into global medical supply chains. And certainly the United States is an interested buyer of products. There's a website, FEMA has a website for companies that would like to export to the United States. It's a matchmaking website, and also provides certain specifications of all sort of PPE. And then on pharmaceutical products, we have more we can take information from companies that want to export that haven't done that before and match them to certification requirements and importers in the United States. Another area I just wanted to touch on is our people-to-people ties, which are, I think, contributing enormously in both our countries. So thousands of Pakistani American doctors and healthcare workers are on the front lines of the coronavirus fight in the United States. The American Physicians of Pakistan Descent of North America, APNA, has donated here in Pakistan almost $100,000 for food rations and $20,000 worth of PPE. But in the United States, APNA also has distributed over $60,000 of food all across the United States and donated PPE in New York hospitals when they were when it was most needed. And then alumni of Pakistani alumni of U.S. education exchange programs, and we send about 800 Pakistanis to the United States, funded by the United States government on education exchange programs every year. A lot of them are very active in their local communities and have been recognized, including by Secretary Pompeo and all of us, for really critical contributions here in Pakistan, whether it's providing food to those in need, distributing face masks, raising awareness of social distancing and hygiene in their communities. And if you follow, or if people follow our various social media, whether it's Twitter or Instagram or Facebook, you'll see examples of this that we like to highlight, because there's wonderful work and a wonderful connection between our countries, and people send in a lot of photographs from both work in both countries of the people who have experienced life in the other. And I would also add, we're collaborating extremely well between our governments and our private sector on evacuating citizens who are caught out in each other's countries, who want to get home, even with the difficulty of air travel at this time. So we really appreciate the government of Pakistan's support for, we had 10 charter flights that took over 3,200 US citizens who were visiting Pakistan back home to the United States. Just today, a flight of Pakistani exchange students is landing in Lahore. Another one landed in Karachi a little while ago. So these are students that had been on US exchange programs whom the US government has chartered flights to bring them back here to Pakistan. And there are other flights planned for and going on where PIA has gotten some particular special dispensation to bring Pakistanis from the United States back to Pakistan. So to conclude this sort of presentation, this answer to the original questions you gave me, I think our cooperation between our two countries has never been more relevant or nor more important to the peoples of our countries. So I really welcome your thoughts and ideas about how to take this cooperation forward. This is new, uncharted territory for all of us. So we are doing everything we can to see how most relevant and effective we can be going forward with the whole of our resources, whether it's government, whether it's business, whether it's civil society, whether it's the peoples of our countries, how we can work more closely together. Why don't I stop there, and you're free to bring up in whatever series you want, but you asked a lot of other questions, and I have to say at the outset, I'm not a public health expert in the United States, so I may not be the best placed to offer lessons learned from different experiences in different US states. We could look at following up on that, with maybe once our CDC experts come here, if you'd like to get into that more deeply. But really, I'm happy to try to address every and any question or comment anyone has. And I really appreciate this opportunity to share some of these thoughts and sort of where we're coming from, and how I think productive this cooperation has been and could be going forward. So thank you, Dr. Saleri.
Thank you very much, Excellency, for your very comprehensive talk, and of course to touch upon quite a vast area and educated us about the cooperation between the two countries, not the government to government level, but also the citizen to citizen level. And I think that is more important, the people to people level contact and people to people level cooperation.